Did you know that the worldwide mortality rate of acute kidney injury is 23%? It means that statistically, 23 out of 100 patients die from sudden kidney failure. While kidney failure can happen due to many reasons, there are some medications, including many over-the-counter medications, that can seriously damage your kidneys and can cause acute kidney injury or kidney failure. Please note that this video isn't meant to scare you or prevent you from taking any medications necessary for the treatment of any health condition you might have. We'll help you understand the potential drawbacks of certain medications on the kidneys and the appropriate way and duration to take those medications so that you can make careful choices. Let's begin. Number 1. Antibiotics. Antibiotics are chemical substances that fight bacteria in the body and stop them from reproducing and causing further harm. But in the process, certain chemicals in them might prevent the production of specific proteins and other compounds essential for survival. Despite their beneficial role in different diseases, people with some specific conditions might be more prone to the side effects of these medicines. For example, people with chronic kidney disease, CKD, and acute kidney injury, AKI. AKI is mostly caused by nephrotoxicity or damage to kidney cells due to toxins. One of the major causes of nephrotoxicity is taking excessive or high doses of antibiotics for a long time. Among all major groups of antibiotics, macrolide antibiotics are considered to be safe for CKD or AKI, but only in certain adjusted doses. For example, azithromycin and clarithromycin are derivatives of an older macrolide antibiotic, erythromycin. Their typical dosage is 250 to 500 milligrams every 12 hours. However, for people with CKD or kidney failure, doctors might reduce the dosage to 50%. The type or dosage of antibiotic shouldn't be an individual's or non-medical person's decision. They shouldn't be taken over the counter without a prescription. Always discuss your medical history with your doctor when getting a prescription. Number 2. NSAIDs or non-steroidal anti-inflammatory drugs. Disprin, ibuprofen, and naproxen are commonly used to treat pain, fever, and inflammation, and are easily available over the counter. These medicines tend to block specific enzymes in the cells that cause inflammation, which ultimately results in relief from pain and fever. But you might be surprised to know that NSAIDs are considered high-risk medications, as they are often prohibited for people with asthma, ulcers, bleeding, heart diseases, diabetes, and kidney problems. In kidneys, certain hormone-like lipid compounds are produced, called renal prostaglandins. These substances tend to regulate blood flow through the blood vessels by inhibiting the function of other hormones that cause the narrowing of vessels. NSAIDs interfere with the normal function of these prostaglandins. This can result in acute kidney injury as oxygen supply to the kidney cells decreases due to constricted vessels. So, first of all, if you have kidney disease, CKD, or kidney failure, avoid taking NSAIDs unless advised by your doctor. Whether a doctor will allow or prohibit the use of these drugs will depend on how well your kidneys are doing. Second, even if you are overall healthy, avoid taking them for a long time because the same blood vessel narrowing effect still applies to even healthy people. There are also some natural alternatives to NSAIDs. Some of them are acetaminophen, bromelain, curcumin, and arnica. Number 3. Laxatives. Laxatives are the type of medicine that is used to ease the passing of stool from the intestines to the rectum, that is to treat constipation. They work by softening the stool, by increasing the absorption of water, or by stimulating colon muscles to push the stools through. Doctors usually recommend 15 milligrams tablets once a day for adults to avoid any potential harm to kidneys and other side effects. However, the excess and prolonged use of laxatives can cause dehydration, which might result in ischemic kidney injury, a condition with a high mortality rate if not medically addressed on time. It can also cause potassium levels to go too low, which too can be life-threatening. If you have a chronic disease and plan to use laxatives regularly, be sure to consult your doctor for the right dosage. Your doctor can recommend a specific type of laxative based on your kidney function. Also, drink 8 to 12 glasses of water when using laxatives to prevent dehydration and ensure their effectiveness. Laxatives like Dulcolax and Metamucil are usually safe for CKD patients, if not used for a prolonged period. However, Long-term use of these laxatives may cause mineral imbalances in the body, so be careful. Number 4. Proton pump inhibitors, PPIs. These medications are commonly used to treat GERD or acid reflux, essentially by controlling the production of gastric acid. PPIs can cause acute interstitial nephritis, which is a condition that happens due to an allergic reaction that can damage your kidneys and may even cause kidney failure if not medically addressed. Its symptoms include fever, skin rashes, and changes in urination. Long-term use of PPIs has also been shown to increase the risk of CKD. For people already with CKD, using PPIs can be more devastating, and that's why they are usually prohibited to CKD patients. Even if you are healthy, avoid taking PPIs for a long time and follow the dosage and duration recommendations given by your healthcare expert. Number 5. Antifungal drugs. Antifungal drugs, particularly a class known as polyene, are commonly prescribed to treat fungal infections in the eyes, skin, and gut. Candida is one of the most common types of fungi that cause yeast infections, like in the skin, oral thrush, infections in food pipes, and several others. In severe cases, Candida enters the bloodstream and can affect various parts of the body, including the brain, liver, kidneys, and even heart. Antifungals, like polyenes, are often used to treat such infections. In simple words, they essentially puncture the cell walls of the fungus, causing it to leak and eventually die. But this class has also been closely associated with renal toxicity. Amphotericin B is an antifungal that's often used against potentially life-threatening fungal infections. However, many studies have shown it to be strongly nephrotoxic, meaning it can cause kidney failure in both healthy as well as high-risk groups of kidney disease. To avoid those issues, the best way is to let the professionals handle them. They can assess the kind of infection you might have and propose the best possible solution according to your medical history and overall health status, including kidney function. Most importantly, do not self-diagnose the fungal infection or go for over-the-counter antifungals, even topical creams. Number 6. Beta blockers. Beta blockers are commonly used for heart patients. Their main function is to lower the blood pressure by widening the blood vessels. They inhibit an important hormone named adrenaline, whose main function is to increase heart rate and blood pressure. But the problem is that by blocking adrenaline, beta blockers also tend to affect the plasma flow as well as the filtration rate of the kidneys. Research about this topic is a bit mixed up. Some studies, including the one published in 2022, suggested that long-term use of beta blockers and other medications used to control blood pressure could gradually degrade kidney function. Other studies have focused on their kidney protective effects, suggesting that high blood pressure can seriously damage kidneys, so beta blockers can help preserve kidney function in people with high blood pressure. So eventually, there doesn't seem to be any reason to avoid beta blockers for someone who doesn't have kidney disease. Many health experts recommend careful monitoring of kidney function in people who have CKD and are taking blood pressure regulating medications as well. Number 7. Diuretics. Like beta blockers, diuretics are often used to manage blood pressure. However, their mechanism of action is completely different. Diuretics work by triggering the kidneys to produce more urine, which causes extra fluid and salts to flush out, making it easier for the heart to pump blood. Thiazide diuretics are commonly used to treat blood pressure. However, many health experts do not recommend this diuretic to kidney patients as it might cause potassium deficiency and may even cause uric acid levels to rise in the blood. However, some of the recent studies, including a 2023 study, suggest that thiazide might be good even for CKD patients. So the bottom line is that diuretics might help protect the kidneys from possible damage due to high blood pressure. But careful monitoring of kidney function is a must for those who have both high blood pressure and CKD and are taking diuretics. Moreover, certain diuretics, such as bumetanide, furosemide, and torsemide, are considered low-risk diuretics. These medications might be less harmful, but their dosage and selection must be decided by a doctor to avoid complications. Number 8. Contrast dyes. Contrasting dyes are substances that are used to enhance the visibility of certain organs and tissues, including blood vessels, heart tissues, or tumors in the body. They are often used in CT scans, MRIs, and sometimes in X-rays. Commonly, iodine, barium, and gadolinium are used as dyes for clear and colored imaging. These materials work by blocking the radiations as soon as they reach the targeted tissue or organ in concentrated amounts. This blockage creates a clear and distinctive image of that particular area, exposing the type of abnormality. Studies show that these dyes might cause cytotoxicity in the kidneys and cause cellular damage due to the production of reactive oxygen species. They have also been shown to reduce renal blood flow and GFR, glomerular filtration rate, which can result in acute kidney injury, particularly in people whose kidney function is already compromised. To prevent kidney damage due to contrast dyes, some medical experts use intravenous injections of saline, sodium bicarbonate, or both in CKD patients to reduce any severe effects on the kidneys. These injections are given 6 to 12 hours before the particular procedure of imaging. Number 9. ACE inhibitors. Also known as angiotensin-converting enzyme inhibitors, are used for hypertension, diabetes-induced blood pressure, and CKD patients. The liver produces a protein called angiotensin, which then is broken down by an enzyme in the kidneys to form the angiotensin I hormone. This hormone is then converted to angiotensin II by special enzymes called ACE. Now, angiotensin II tends to constrict blood vessels and increase blood pressure. ACE inhibitors are usually prescribed to reduce the production of angiotensin II. This can be beneficial for kidneys too, as it helps in maintaining glomerular pressure, proteinuria, and systemic blood pressure. According to the National Kidney Foundation, ACE inhibitors are least likely to cause acute kidney injury and may even benefit people with CKD who don't even have high blood pressure. However, there are certain medications that ACE inhibitors shouldn't be taken with. These include NSAIDs like ibuprofen, naproxen, aspirin, and diclofenac tablets. Plus, taking ACE with certain diuretics might also increase the risk of kidney failure. But that isn't necessarily true for everyone with high blood pressure or everyone with CKD or both. Number 10. Statins. Statins help to reduce the cholesterol levels in the blood and assist the liver in removing LDL cholesterol from the blood. Among other side effects of statin medications, dizziness, muscle pain, digestive problems, low blood platelet count, kidney damage, and muscle degradation, rhabdomyolysis, are the major ones. One study even showed that people taking high-dose statins are 34% more likely to develop kidney damage within the first 120 days of treatment. With healthy kidneys, you probably don't need to avoid statins. But if your kidney function is already compromised, talk to your doctor about your condition and get the proper recommendation according to the degree of your kidney function. Number 11. Antivirals. There are a lot of viruses present in our ecosystem. Among these viruses, very few can cause infections in human beings. These viruses cause different types of infections, including flu, HIV, hepatitis, common cold, and several others. Antiviral drugs are made to fight them and stop their reproduction. These antivirals work in various ways. They might prevent viruses from attaching to healthy cells, prevent the synthesis of their DNA and RNA, or boost our immune system to fight viruses. But the potential drawback is that these antivirals might also interfere with the cell replication of healthy cells. This can cause side effects, including nausea, vomiting, pain, dizziness, and headaches. Some of them might even cause damage to the brain and kidneys, as they show neurotoxic effects on the central nervous system and nephrotoxic effects on the kidneys. The severity of these effects usually depends on the type and dosage of antivirals. Almost all common antivirals can cause kidney damage and even kidney failure in some cases, but that's why there are recommended doses. Following the advice and recommendations from your healthcare expert about the dosages and timing of medications can ensure that their side effects are minimal without losing their effectiveness. Number 12. Psychiatric medications. These are the drugs used to treat various mental health problems like depression, anxiety, panic disorders, bipolar disorder, and other illnesses. These drugs reduce the symptoms of these illnesses by regulating chemicals related to emotions and behavioral patterns. Psychiatric drugs are usually safe if they are taken under an expert supervision. However, long-term usage or self-medication of these drugs may cause serious side effects. Some of the common side effects of these medications include drowsiness, nausea, seizures, insomnia, constipation, weight gain, memory loss, and coordination problems. In some cases, they can also cause serious damage to the kidneys, with some of them having the potential to cause acute kidney injury followed by muscle degradation. Studies show that a special group of antidepressants can use to treat these psychiatric conditions with minimal effects on the kidneys. These are known as SSRIs, or selective serotonin reuptake inhibitors, and are considered safer compared with other typical antidepressants. With the knowledge of common medications that can damage your kidneys, it's equally important to be aware of many common foods that can damage your kidneys. For that, make sure to watch these videos on our channel.